A very good morning to you. How are you doing? I hope that you're well, that you're blessed, that you're happy. It's such an amazing day to be alive, to be happy, to be healthy, and all of the good things that are happening to us. Amen. Amen. Karibuni sana. This is MBCI TV ambapo tunabadilisha maisha by the grace of God. Today is the 22nd of January 2025 and that tells you that time is really running. Imagine tuko almost kumaliza January ile yenye watu sema iko na 78 days. Really? No. We are almost done and we thank the Lord so far. This is Afya Clinic where we talk about everything health, and today we'll be having amazing discussions. We'll be having two guests on set. We'll be having Mr. Mulandi, who is not very new to you. Tumekuwa na yeye hapa not once, not twice, talking about Goshen, and doing this because we say that Afya Clinic is a wholesome show. So we talk about everything health. So we'll be talking to you who would love to get into the medical world. Yeah, if you'd want to do medicine, you'd want to do nursing, you'd want to be a nurse assistant, you'd want to do anything health, we'll be talking to you today. Sawa sawa. If you have that dream, Mr. Mulandi will be coming in a very short while as we talk about that. But of course, we know that January has been Cervical Cancer Awareness Month, and today we have something that will be happening at PGH Nakuru. So later we'll be having a nurse who will be talking about that, an oncology nurse who will be talking about that, so we'd know about cervical cancer. And of course, if you're in Nakuru, we'd tell you kama kuna vile unaweza fika pale PGH usaidike. So we'll be talking about that later in the day. Lakini karibuni sana. We're very glad to have you. Thank you for sparing your time to be with us today. Tutakuwa hapa mpaka pale 10 in the AM, and I know that it's going to be an amazing time right here in the presence of God as we learn and as we enjoy just getting into this discussion and learning as much as we want to learn. Our numbers are very open. That is 0721 105 105 on WhatsApp, 23814 our SMS code, which is absolutely free of charge. But of course, we are live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. Ukienda pale, we'll be able to get your feedback. Tutakusikiza, tutasoma messages zenu na tutakujibu. But tukianza tu, we'd want to know, how are you doing? How are you feeling? How's your week been so far? The last time tulikuwa hapa on Afya Clinic ilikuwa on Wednesday. So how have you been from Wednesday to today? Tulisema hapa ndani ya Afya Clinic wiki yetu inaanza Wednesday. So how has your week been? Tuambie. Our numbers are very open. We'll be starting with that. Talk to us. Share with us. Pia tuambie unatuwatch kutoka wapi, unatuwatch na kina nani, and what are you thanking God for? Lately, I've been thinking about how we have so many reasons to thank the Lord. And sometimes you just think, really, do you have reasons to thank the Lord? But ukiangalia deeply, there are reasons to thank the Lord. Now today, as we start, I want you to share with me, what are you thanking God for today? What is that one reason that you're thanking God for today? Sawa sawa. So talk to us, and our numbers are very open. Alafu tutakuwa tukirudi kusoma your feedback as we get into the topic of discussion. On all social media platforms, ukienda pale utafute Kahugu, Rachel Kahugu, utanipata. And as you text your messages right there, I'll be getting them and getting back to you as well. Once again, thank you so much for tuning in. We do value your time highly. And as you continue with this discussion, I believe and hope ya kwamba tutasaidika sana. Now, today we'll be starting with an amazing segment ambayo tumetengenezewa na the one and only Sylvia Wanja. Every week we get to look at how to continue living healthy. So that is healthy living. So we'll be taking a look at that segment. As we come back, we'll be coming back with Mr. Mulandi as we talk about Goshen. So Goshen inakusaidia wewe ambao unataka kuwa trained to be a medic, to get trained and get trained vizuri sana. So if that is what you want as well, we'll be talking about that and your questions will get answered. All right, but for now, wacha tuingie pale ndani ya healthy living so that you can get to know how to continue living healthy.
Hello and welcome to Healthy Living. My name is Sylvia Wanja. Healthy living is about adopting habits that promote physical, mental, and emotional well-being. Here are practical tips to help you lead a healthier and more balanced life. Number 1, maintain a balanced diet. Eat a variety of foods. Include fruits, vegetables, whole grains, lean proteins, and healthy fats in your meals. Limit processed foods. Avoid foods high in sugar, salt, and unhealthy fats. Stay hydrated. Drink plenty of water throughout the day to support digestion, energy, and overall health. Practice portion control. Avoid overeating by eating smaller portions and listening to your hunger cues. Number 2, stay physically active. Engage in at least 30 minutes of exercises on most of the days of the week. Activities could include walking, jogging, cycling, and swimming. Incorporate strength training and flexibility exercises to enhance muscle health and mobility. Take short breaks to stretch if you sit for long periods. Number 3, get enough sleep. Aim for 7 to 9 hours of quality sleep each night. Create a consistent bedtime routine and sleep schedule. Avoid screens, caffeine, and heavy meals close to bedtime. Number 4, manage stress. Practice relaxation techniques like meditation, deep breathing, or mindfulness. Make time for hobbies and activities you enjoy. Seek support from friends, family, or professionals when needed. Number 5, practice good hygiene. Wash your hands frequently with soap and water to prevent infections. Maintain oral hygiene by brushing and flossing daily. Keep your living and work environments clean and organized.
We are back, and that is Healthy Living by the one and only Sylvia Wanja. Asante sana. We say that we make sure we live healthy because it's very important. Tulisema hata tukibarikiwa na pesa. I know we pray for everything else. We pray for a good family, we pray for money and all that. But tukiomba hizo zote, but then we're not healthy, we'll not be able to enjoy all that. So health is also very, very, very important. Okay? Now we are back so that we talk about Goshen. So this is to tell you if you have any friend, any family member mwenye unajua amekuwa akitaka kuingia into the medical world, this is the time for them because there's an opportunity for you and it doesn't matter. Tumekuwa na Goshen hapa a lot of times na amekuwa akituambia it doesn't matter kama ulipata D ama ulipata. It's very important kufanya exams na upite vizuri. Sawa sawa, but you can always pursue whatever you want to pursue with Goshen. All right, so that is what we'll be talking about. So if you're there, you've been wanting to pursue these, this is your time. So come on board. As we said before, our numbers are very open. That is 0721 105 105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. And then you're live on Facebook, on MBCI TV Facebook page, you're live on YouTube, on MBCI TV official YouTube page. So you can send in the links to your people so that they'd be able to follow and get educated as well. Others, karibu sana once again. This is Afya Clinic right here on MBCI TV. My name is Kahugo and today we are here with Mr. Mulandi from Goshen. How are you?
I'm fine, Rachel. How are you?
Sana.
Asante sana, nashukuru.
How have you been?
I'm doing well. I have been well. Mwaka huko Goshen tumeanza vizuri na tunaendelea vizuri, tunashukuru Mungu sana.
Amazing.
Yes.
In fact, Happy New Year.
Happy New Year to you. Hatujaonana this year.
Yeah.
Tuliachana last year somewhere September there.
Yes.
But the Lord has kept us.
Amen.
Goshen tuko sawa. Tunaendelea vizuri and the right hand of God of power is at power.
Amen.
Yes.
Hey, we're very happy to see you once again.
I'm also very happy to be here this morning.
Tumekuwa tukionana kwa mtandao.
Kwa mitandao tu.
Yeah.
Actually, we have been busy because of the admissions.
Yeah.
The later part of the year, that was September. Na tumeanza January pia with admissions. So tumekuwa engaged so much.
Okay.
That is why, but we thank God because of social media. And I thank God to be here.
Yeah.
Yes.
So far, at
so
Goshen.
far, so good. As Goshen, we still remain the best.
Amazing.
Yes.
Yeah, it remains the best. You and I, mpaka tumekuwa tukipata testimonials. Yeah.
We thank
from
God.
The people.
We are trying our best to maintain that.
Yeah.
To maintain our reputation and to maintain the standard.
Amazing.
As we always promise our customers.
Amazing.
Yes.
In fact, if you're there and umekuwa Goshen, ama as we talk kuko Goshen, tell us about it. Send in your message. Najua it's a really good school.
Yeah.
So ukiwa pale tuambie and we'll be really glad to read your messages.
Yes.
So for the people who are seeing you for the very first time, unajua sasa with new year tumeongeza familia.
Tumeongezeka.
Tumeongeza familia. So for the
Yes.
people who are seeing you for the very first time, please say hi to them. This is your camera.
Wonderful.
Yes, and tell them kidogo about Goshen.
Wonderful. Good morning, my viewers. My name is Peter Mulandi. Peter Mulandi is a marketing manager from Goshen Medical and Technical College. We are at Thika. And today I have come here so that we may talk more about Goshen. Maybe for someone who wants to join us, maybe for someone who has been hearing us and now we have just come to your doorstep, so that we may talk and engage more about Goshen Medical and Technical College, talk of medical courses, talk of technical courses, and talk of business courses. We shall be able to handle them.
Amazing.
Karibuni sana.
Asante sana.
Asante.
Now, unajua tumekuwa tukiongelea Goshen, and I know we already have people ambao wamekuwa Goshen. And Goshen is widely known for the medical courses.
Yes.
Sasa najua umesema business, watu wako like, business as well, what do you mean? Najua watu wamezoea sana Goshen with medical courses.
Actually, for your information, because of the demand, we have started business courses.
Oh, wow.
Courses like business and administration, courses like office and administration, yenye tulikuwa tunaita secretarial.
Yeah.
So those are the two courses yenye tumeanza pale kwa business. The rest they are in the technical.
Okay.
And they are doing well already. We have students.
Amazing.
Because of the demand, we just have to give them. Yeah, exactly.
Okay.
So we have added a business wing, which is also doing well.
Amazing.
Yes.
Let's start from the business kabla tufike sasa kwa hizi za medical ambazo najua ndio tutakuwa tukiongelea sana.
Yes.
Let's start from the business na najua you've mentioned them kidogo. Just break it down so that people would know naongelea gani. You've talked about secretarial.
I've talked about secretarial. Secretarial siku hizi inaitwa office and administration. Office and administration ndio iko na front office. Someone who is doing from craft itakuwa front office operations. Someone who is doing from level 5 and level 6 it is office and administration. Basically ni ule mtu tu anasaidia pale kwa ofisi. If I just mention the name secretary, you'll be able to, but now office and administration it is coming with bigger roles.
Okay.
As an office assistant pale. We talk of business and administration, we talk of HR. HR is widely known. So those are some of the courses that we are having for the business, and we are continue unveiling more and more depending with the demand and job market there outside. Yes.
Okay. So that's the business side.
That is the business
mostly.
side. That's the business side.
Okay.
Yes.
You said kuna zenye ni technical.
Kuna zenye ni technical.
Which is?
In technical, we are coming up very well actually. We have ICT there. We have plumbing technology.
Okay.
We have things to do with hospitality, that is catering. We also have cosmetology. We also have hair dressing and beauty therapy. We also have electrical engineering and electronics.
Yeah.
Those are some of them that we are doing, and our students are happy.
Yeah.
And we are doing well. We are doing well in that, in technical.
For sure.
Yes.
You know, the other time we were there's a show tulifanya tukiwa pale kwa ground.
Yes, I remember.
Yes. And while we were there, we could see the students are very happy. Yes. That is not normal. Mostly shule zingine was na feel kama prison. Ikifika siku ya kwenda shule watu wako like, hey, you are going back to school already.
Actually, when you come to Goshen, the student who has a class ya around saa 8, wanafunzi nampatanga kwa compound saa 2. Like now I'm sure they are already flooded in the college.
8 a.m.
They like the serene. 8 a.m.
Yes.
They like the serene because we don't push our students out because we saw us we have an advantage of space.
Yeah.
There is a you need even to come again. Ukikuja nitakufanyia orientation tena. It has totally changed.
Oh really?
Totally changed. It has totally changed.
We will plan for that.
You need to bring Afya clinic there.
Yes.
As we do some other things there to the community.
Tutakuja. Yes. We really love the place. So if you're there and you want a good school, no, you know, I'm talking from experience. I'm speaking from experience. It's a very serene environment and the students are very happy. Very happy. So that is the place to be. Sasa tuende kwa the medical courses.
Yes.
Which people widely talk about.
Exactly.
Karibu hata nibaki huko the last time we were there.
You wanted to do nursing.
Kidogo nifanye nursing. I even told you by the way.
To come.
Yeah.
You still have opportunity to come.
Tutakuja.
Yes. Sio vibaya kufanya course mbili. Hata mimi nilichange.
Oh really?
Nilianzana na ICT na nishaingia kwa medical bado. So it is it's not bad.
Sawa. Tutakuja kwa hiyo medical.
Karibuni.
Now let's talk about the medical courses.
Yes.
What is the range?
We have more than currently 64 courses.
64?
64 courses now which have been approved and accredited by, and now we have another board which is called KHPOA, Kenya Health Professional Oversight Authority, which is oversighting all the other courses that has not been regulated initially one of them being nurse assistant, and now nurse assistant ikakuja na ikaitwa health support services. So whatever we call patient attendants, healthcare assistant, nursing aid, caregiving, it has been compiled to one body under KHPO. And the course is called HSS, that is Health Support Services, and the profession is called HCA, Healthcare Assistant, not caregiving or any other name that we call it there. And it is going for 1 year, and that one is taken from the lowest grade, grade. Now we have School of Nursing, but currently our class is full for the nursing up to 2027 tukichaguana. That is for the Kenya Registered Community Health Nursing. But good news is that we have been approved by the COC, that is Clinical Council of Kenya. We are taking clinicians match. We are taking clinicians match, and already applications they are open. Nimeona we are halfway. So I'm sure by the end tunamaliza hii maybe itakuwa imejaa. Yeah, that is the Department of Clinical Medicine.
Let's first talk about the clinicians before we continue. Kwa sababu umesema iko halfway, which means iko karibu kujaa.
Exactly.
So for someone who's thinking about it, clinician ni nani?
Clinician nao ndio sasa tunaitanga madaktari huku nje lugha ya mtaa. Those are the people now who attend patients, who give medications and such. Sasa for example ukienda pale ukiwa mgonjwa, they do diagnosis and such. So hao ndio tunaitanga madaktari sasa.
All right. And what is needed for someone to come into the course?
For you to be a clinician, you need to have a C plane, mini grade, and of course chemistry is a compulsory C plane. And we also need to have a C plane also in either mathematics or physics, and also we have to need to have a C plane also in languages, one of them, either English or Kiswahili. Actually it's the same as nursing, only that for nursing it is either chemistry, physics or mathematics, but to the clinical medicine and surgery it is either chemistry is independent, biology is independent, but for what do you call it, physics and mathematics, one of them. For you to be a clinician.
Najua tutakuwa
tukiwaambia.
Najua tutakuwa tukiwaambia how they can apply for that.
Yes.
Now, why is it that nursing imejaa?
One, can I say it's about because of the reputation of the school? I don't know, but I'm confident in that. Secondly, I was inquiring even from the other institution. I realized some of them they are being full. Two, nursing is always limited. You cannot exceed a number of 40. Because if sahi tumejaza mpaka 2027 and we mention 40, so tukichukua 100 students uta realize kwa hospitali nurses are full. Nurses are more than the patients. So I think there is a way Nursing Council of Kenya they are regulating that, and secondly they are very serious. Actually a lot of schools have been closed up because of this mchezo. So because of the demand here and abroad, I think that's what has transpired for the nursing to be demanded. It is very practical. You cannot be a nurse and miss the mark.
For sure.
Not even nursing, but any other medical course. You cannot do any medical course and miss. Hawezi kosa.
Now, there's a time you're talking about taking nurses abroad. How is that going?
Actually, even now we have another tender of more than 1,000 nurses. We took 68. We took 68 nurses, and we are still having another tender for as many as we can. For nurses. Qualification na kuwa kona experience ya 3 years na kona license ya Nursing Council of Kenya, because government cannot allow them to go without the license. Ndio wasiende wa mesi huko tuanze kuambiwa sisi ni wambaya. So kama kuna mtu wako hapo nje na anataka kwenda huko kufanya kazi ngambo, we still have those chances for nursing. Bora ukuwe na at least 3 years experience and at least ukuwe na the license from the Nursing Council of Kenya. Wetu tumepeleka wakaisha, so
sasa mnatoka wengine wakupeleka.
Hata si lazima wakuwa wamesomea Goshen.
Which means that as much as we'd say that nursing iko na watu wengi, si ati sasa hakuna job market, because you know that's the thinking ya watu wengi.
Market is there. Market is there. And then I usually tell people, because I usually receive those inquiries from the students. Like yesterday I was handling such questions from the parents, like is this course marketable? Because mzazi anakuja na kupea results unamwadvise then anakuuliza is this, which is a very good concern but marketability of a course it depends with you first. Kuna kitu lecho inaitangwa passion. If you are here in media and you don't have a passion of what you are doing, definitely hatutaona Afya clinic. Sindio? Because you have, there is a driving factor, there is a driving force inside you which will make you stand out tall than the others. You see, so even when you take you to an hospital for example, kuna wale wako sharp, kuna wale wako lazy, kuna wale they have something which is driving them which will make them outstand the rest. So passion will make you become more marketable. So still market iko lakini pia na wewe kuwa na passion ya hiyo kitu. Usifanye because of tu nataka because of you want just to go abroad. Hapana, itakulemea. Itakulemea.
Okay. Perfect. Now, we'd be getting into questions. Naona kuna maswali ambazo zinakuja. But before tuende kwa hizi zote, because you know this is a question yenye inakujanga every time we have you on board.
Exactly.
What are you about bridging? Now let's start with what is bridging.
Now, I want to thank you for that question. By the way, I have been handling that. We have been analyzing results for these for 2025 candidates, and we realized sciences at least they have been down kidogo. Someone wants to do this course, but unapata some clusters inakata. Bridging one, for example, if you want to do nursing, qualification should be a C minor. But remember, I said in English or Kiswahili should be a C plain. Assume that Kiswahili ulipata D na English ukapata C minus. You don't qualify. Lakini grade uko nayo C plain, you qualify. So what you do in bridging, you come, we train you, we rebook that exam again, not the whole exam, but specific unit. That is a specific subject. That is, for example, in this case, English or mathematics or any other subject in sciences in that line. You come, we are our next center for that course. We train you. Then by the end of the year, that is on November, when the KCSE is on course, you do that paper alone. So kama the main results ulikuwa na C minus na umepata C plain, you will get another transcript from NEC yenye inaonyeshana English peke yake na umepata. So when you are taking your results, we just attach. Anytime you are presenting your result, you attach. But parents need to know that bridging does not affect mini grant. It affects the subject. So kama ni juzi uienda case someone mwenye anasema nataka kufanya bridging na kona D+, nataka kufanya bridging afanye nursing. So the advice was you either do another course or you go back to form 4 so that we may repeat the whole exercise. Because even if we book you 7 units, we only allowed for 5. Because if you repeat a 5 year in the whole subject, so you need to go back again to form 4. But if you don't want to go to form 4, just do another course, start pale chini, ukipanda. In that case, we alikuwa nataka kufanya orthopedic and trauma, but alikuwa amekosa tu kitu kidogo. So tukamweka anafanya bridging, anapanda. The other one mwenye alikuwa na D+, tukamu-encourage afanye another course, aanze chini kwa certificate, akienda diploma, then afike mahali anataka. Alternatively, aende form 4, bridge, arudie the whole exam. So bridging does not affect the mean grade. It affects the subject. And yes, we do it with the NEC. Yes, we do it with the NEC.
Now, ukishafanya bridging, ina take how long?
Ina take 1 year.
So while you're doing this bridging, is there anything else you're doing? Assuming I'm only doing English. Sasa takuja nikae Goshen a whole year for one subject, ama there's something else.
What we usually do, huwa tunawapea a certificate course ya 1 year. Certificate course in our case, for example, all those students who are doing a bridging, either they wanafanya certificate in theater technology, ama wanafanya nurse assistant, because either of the course it will take 1 year. For example, wale wameingia sahi, because we have a big number wameingia for bridging now. So wameingia alafu wanafanya bridging na wanafanya theater technology certificate. Inaenda 3 terms. Bridging inaenda 3 terms. So the moment unafanya NEC, at the same time utakuwa umemalizana na theater technology. Ukimaliza, if you are bridging to do nursing, ukiingia nursing utakuwa wewe ni nurse na bado wewe ni nurse theater technologist. So you gonna what we call an added advantage. In case uanguke, because exam is fail or pass, in case uanguke hautakuwa in despair ama hautakuwa nini. So you've done something. Bado ukitaka kureceipt tena you can you can continue, you can visit, but already you have a certificate.
Okay.
Watu wakiuliza kazi unaweza uliza. Watu wakienda kazi unaweza enda. Yeah.
Okay.
Hautakuwa umewaste 1 year, but it is still optional. If you want to do it peke yake, maybe you are engaged somewhere else, you can still do it, because we have others from other institution wanakuja wanasoma huko nje lakini anakuja kubringe in our institution.
Okay.
We also accept that.
Okay.
But we encourage do it with another course at least, because we don't know tomorrow. Yes.
For sure.
Yeah.
Let's talk about nurse assistants. Kazi ya nurse assistant ni gani?
Hivyo tu imejiita nurse assistant. Now, the moment it has been taken by the CDAC, CDAC is the examining body, kwa tunaita kitambo NEC. Now it's called CDAC, TVET CDAC. Pale hospitali, caregiving, patient attendance, all those names tulikuwa tunazita. Kazi yao ni kuassist nurses.
Okay.
Assist nursing in drug administration, dressing patients, kama kuna prescription amepewa, to make sure that patient is stable in all the department. Kama kuna kwa labor ward anasaidia nurses pia pale kwa delivery, kwa MCH kwa watoto because of kupeana polio, chanjo and such. Anything that a nurse can do, nurse assistant also does.
Okay.
Yes.
Okay.
And even nowadays they rotate up to, because umeona kuna unit imekuja inaitwa mortuary science. So ama mortuary techniques, they even rotate to mortuary.
Okay.
Na wameletewa ingine pia inaitwa catering, inaitwa hospital catering. Pia, so they can even cook for the kwa wagonjwa by the guidance of nutritionist.
Okay.
Yeah.
Wow, I see. Kuna mtu anauliza about the same, umesema zote ziko under nurse assistants, but yeye anauliza about caregiving.
Ndio hiyo sasa.
Yes. Anauliza, can the course be offered online?
Yes, we have what we call blended learning. That is, anaweza fanya online, anaweza kuja ikuwa inaitangwa school based, anaweza kuwa distance learner. Like we have 6 students, 2 from Britain, 1 from Turkey, another one I don't know which country. They are doing purely wakiwa huko. So the only time they will come to Kenya, they will come to do exams. So wanatumiwa assignment, wanafanya, wanatuma in our, we have a system that can accommodate such. So we do offer. Yeah. Okay. But exam time lazima akuje shule physically.
Very important.
Yes.
Very important.
Yes.
All right. Asante Christine, nimeona ujumbe wako. I hope that has been answered very well. Anasema which institutions, wanauliza kama mko na scholarship. Anasema my daughter got a plain A in KCSE but kidogo hawezi kumsomesha, anaitwa Mary kutoka Meru. So anauliza, do you have scholarships?
We don't have scholarship as per se, but what we do, we have someone we call a liaison officer. Like as we are talking now, he has been in, since results go announced, because umeona mambo na bursaries zimetokea. So we usually check the students that we have. For example, wale wako na huge balances, because kuna wanafunzi wako na huge balance, naangalia ametoka which county. Then on behalf of the student, we send our liaison officer in that county down to the CDF, down to the ward. So tuna make sure watu wote tumewaongelesha on behalf of the student. So kama for example ni hapa Nakuru County, wanafunzi wote wenye wa Nakuru County they are in negotiation. We go to the governor, tunaongea na wao, ama whoever is concerned with the MP CDF money, tuna mobilize resources for the students, then tunakuja wanafunzi wanalipiwa. Yeah, but we don't have a certain scholarship that this is for this and this is for this, but we help students get such. Yes.
So someone kama huyu mwenye anasema mtoto wake ako na plain A, should they call, ama what's
they need to call us so that we know first which county, and then we need first to enroll the students so that kwanza kuwa wa student ndio sasa tuweze kufanya nini, because lazima kuwa admitted so that we can follow up as our student. So they need to come to the institution, or they just call us through the numbers which are there, and then we'll be able to assist where possible. Yeah.
It's also good to mention that the other time you said, unless it has changed, tutatuambia, the other time you said that it's not expensive, it's very affordable. Na kuna watu wenye walikuja waliamua tu kuanza and they started na walimaliza.
I wish those who have joined the September or those who are still joining, because we are still taking the for January, they can confirm. We have students, parents who are coming. Even on Thursday, I admitted a parent from Narok. He came and they said yes, this a certain amount of money and I cannot mention, but ilikuwa ni kidogo. Akasema I have this amount na huyu mtoto sitaki akae nyumbani. Nilimwambia hii ni mingi sana mama. Niachie mtoto, acha hii pesa wewe enda nyumbani. Enda ulishe ng'ombe vizuri, ikiwa naona uza leta. Mtoto asome. And the parent was very happy because alikuwa amejaribu several institutions. Paka sijui alituona ama alisikia wapi, I don't know, but she came na akasema nimekuja hapa, nimetumwa hapa. Na aliacha mwanafunzi. So ako around 4 days in class na anasoma. Yeah, so Our college is very, I can say, it's pocket friendly, and we negotiate with the parents in a way that if you cannot afford this, can you pay in installment, or how long can you pay this amount? But hiyo negotiation yote ikifanywa mwanafunzi yako class akisoma, because our tag is, our motto is empowering future professionals. We need to empower everyone. We need to empower everyone. And also I think it rhymes with yours. We need to transform lives. We need to transform lives, and we cannot transform lives tukiwa tunafinyilia watu pale chini. So mzazi akifanya due diligence, anaona the Goshen is the right place to be. The question of money should not be in the mind of the parent. Wacha mzazi yakuja ajiongelele. What we want is ile inaitwa honesty. Mzazi yako tu honest, like mimi niko na hii pesa, by the end of 2 months ndio nitapata this amount. Ataandikwa tu chini, then that time I comply, then itakuwa sawa. But hapa katikati what we do, na nilisema tena, we don't send our students away. Like now they have reported last week. Sijaona mahali wameitwa parade waambiwe so and so endea pesa, so and so endea pesa, because I believe tukiwa kwa class alafu mtoto ajue wewe hujalipa, mwingine hujalipa, in a way it will affect psychology ya mtoto. So we tunajaribu kuwafananisha wote, and in case there is an issue tunamuita kwa ofisi. Now we do a follow up. The rest they cannot know what is happening.
Well, that's beautiful. That's really beautiful. Now, we'll be getting some vox pops, because there are people who are talking about how to enroll for a medical course. Na pia wakitaka ku enroll for a medical course. From their perspective, what do they think they should do? Sasa wacha tuwasikie, because we have them. So let's get the vox pops so that we can all hear what their view is on the medical courses. And then we'll be coming right back to talk about that. If you have any question, if you'd want to enroll, not only for the medical courses, but remember kuna technical courses, kuna business courses. So kama uko pale nyumbani, you just cleared your form 4, and I'm so used to the form 4 and I keep forgetting that tulimaliza 844. So I was in high school, my former high school, the other day last week, and yes, it's the CU chairperson, Mr. Carey. God bless you. He was telling me, unajua kama sasa sahi hatuna form 1. And in my mind I was wondering, what do you mean hamna form 1 and you're a high school? And then
things are changing.
Just clicked, but things are
actually NEC is being swiped away. Swiped out slowly. Like in July we are having a NEC exam for them who have not done last year. That itamaanisha inatoa backlog yenye ilikuwa, then by the end of the year tukue na ingine, next year by July tukue na ingine, then itakuwa imeisha. So sasa tutaingia kwa system. And it's a good system. Personally I support it 100%. It's a good system. Yes. Yes.
I see. Now, if you have any question, please, our numbers are still very open. That is 0721 105 105 on WhatsApp, 23814. Our SMS code, which is absolutely free of charge. But of course, you can only upande mwingine wa MBCI TV Facebook page, utatupata pale we live, and of course MBCI TV official YouTube page. You can pale on the comment section, we'll be able to get you feedback. But of course, you can always get me on all social media pages as Rachel Kahugu. Pia pale, I'll be able to find your feedback. But for now, watch out pate the vox pops, and then we'll be coming back in a very short while.
Wacha tuseme there are so many factors. For one, wakati mtu akiwa mdogo, kuna ile passion yenye inakuwa ndani ya mtu. Nasema, when I grow up, I would like to be a doctor. Well, that one sometimes may not come to pass, because as we grow up, our interests change, and maybe even unakuja kuelewa what being a doctor entails, so unasikia labda sivyo. But I think the real cause, kuna wale ambao wana hiyo msukumo yenye haififi. Tena bearing in mind even the way the grades that are needed for somebody to become a doctor. So maybe somebody is not bright enough to accomplish those grades. So along the line, somebody may drop out, and somebody else may want to work hard to achieve that goal. Another thing could be that maybe wewe ulikuwa mgonjwa, ukaenda hospitali, ukawa mistreated or mishandled, and ukakasirika ukasema, if I was a doctor, I would have done things differently. Ama labda ulienda hospitali, ama mtu wenu akaenda hospitali, ama rafiki yako akatibiwa vizuri, mlikuwa almost give up na yeye, ukaona ametibiwa vizuri na amepona, so akajisikia kwamba hey, I would like to be doing job, because it is restoring hope to the society. So I think those are some of the factors that can lead somebody to want to become a doctor.
Mostly it's a career subject due it's a course that huwezi kosa job. Pia maybe if you are passionate about saving life.
I think ni desire ya kufanya create an impact for society. Maybe msee amekuwa na wasiwasi kama wenye watu wana struggle, so ana work hard to ensure wase wanapata hizo services easier.
So that is it about getting into the medical field or the medical world. Na mwana watu wengi wanasema about passion.
Yes.
Ukiona mtoto kutoka kitambo anasema nataka kuwa daktari, you do know hapo kuna passion.
Yes.
Which I think that's really important, as you had mentioned.
That is very important. And I thank God because of TVET. I thank God because of this CBC thing.
Yeah.
Because I like that mom who has said that maybe ulikuwa na hii interest but hujafikia hiyo grade or such. Someone should not kill himself because maybe haja attain B+ and he wanted to do this certain course.
Yeah.
The whole idea about TVET is what we call hands-on skills. You can start to the lowest part of it. Like for example, we can give it a practical example. Me nikiingia form 1, I wanted to be a neurosurgeon.
Yeah.
Because I thought I will perform more than what the government is expecting. Then after form 2 nikacheremka chini kidogo nikataka kuwa pilot. Form 3 nikaona nataka kuwa engineer. So kitambo nifike form 4 ndio nilijidentify, this is what I want to do. And you see people, because in our society we are judging people like umepata A, so definitely utafanikiwa kwa maisha. Mtu amepata C-, huyo mtu ana maana kwa society.
Yeah.
So because of that, so many people tumeweka special, like that lady was here said that maybe it's time ya mtihani ulikuwa mgonjwa, but that was an A material. So huyo mtu tunamdescribe as a D material, so already tumediminish mentality yake na mention is nothing in the society.
Yeah.
So thank God for Goshen, thank God for TVET, because utafunzwa what we call a hands-on skill, such that if it is you and this camera, not the books and you. It is you and this camera. If you know, you know. If you don't know, you don't know. That's the whole idea behind that.
Okay.
Yeah.
Wow. And you know, I'm just thinking about how that is a very good idea. Now, I'll ask this question, but followed up with this explanation. The other time you were here, nilikwambia, maybe I really wanted to do nursing. I thought it's something I wanted to do until I realized it's something I didn't want to do. At one point, I was actually... mpaka nilikuwa nisha identify nafanyia wapi. I even had my mom knows, I had the letter. The admission letter. The admission letter. But then I realized my passion isn't singekaa kwa hospitali. There's something in me haingekaa tu kwa hospitali. But then most of the people really don't get the opportunity to realize that wanakwanga washaanza course before they even get to know that this is not my field, this is my field.
You realize when it is already late.
Very late.
Beyond repair.
Correct.
Yes.
Now my question is, when the students are coming to enroll for these courses, do you have a time to talk them through what the course entails, after studying where they'll be, that they'd be able to go to hospital and actually see blood, attend to patients?
Actually,
is that something you take them through?
Actually, we have a very good process of admission. And usually, because we have our WhatsApp group for those who are joining, like for those who have joined in January, we had our WhatsApp group. I was encouraging them, before you come to the college, come with your parent or come yourself, present yourself to know more of the course that you are doing. Because most of them wanafanya, nataka kufanya theater technology because my sister or my whatever is doing the same course. So unataka tu kukuja kwa ole kufanya hiyo because unaona huyo anafanya hivyo na maybe amefanikiwa. And if you don't come before the admission day, that admission day, the first desk inakuanga ni ya document verification, your performance. The second desk inakuanga ya kuangalia ile course umeitiwa. With ndakuanga na career guiders na counselors wanakuanga wameket in station 2. Unaulizwa hii course unafanya, do you know anything about it? Can you figure out 10 years to come where you will be and who will be, and like unajaribu kuassess huyo mwanafunzi, unamuona ikimaliza unamwambia this is the right course or this is the right route. Na most of them wamekuwa wakifanya hivyo. Tomorrow we are having not tomorrow but next Thursday we are having a career day with our students, all the students. Like if you have done for the first semester our September na hawa sahi wameingia sahi wa January. We have a career day with them. If you have done the first semester na umesikia hii kisi unafanya si yenye nilikuwa nataka, you still have a chance to change. So we have a career day mahali tutaweka tents, wanafunzi wanakuja wanapatana na the experts, unauliza questions. Unauliza questions. So that one we usually do very well because tunataka mwanafunzi akifanya chenye anafanya anajua ni nini anafanya. Yes.
Very important.
Usimalize alafu kuwa tu this is not what I wanted.
Later,
and we are doing it very well. And I like our parents because they are doing a very good follow up on the same. Anataka kukuja ajue hii shule watatusaidia jamaa hivyo mwanafunzi inafanya ni nini. Because in our times wazazi wanajua tu engineering, teaching, sijui nini ingine na daktari ni hivyo tu, but now kuna hizi courses zingine zinatokea zenye wazazi hawana knowledge, so they have to come ujue what is it, and then tunasaidia mwanafunzi kujua chenye anafanya chenye atakuwa. We usually have that desk.
Very important.
Na personally hata ni mimi naifanyanga.
So wakikuja pale watakupata.
Wakikuja pale watanipata.
Very important. Very important. Anaitwa Mary Mwangi anauliza perioperative theatre technology, is it marketable?
Very much marketable. Very much marketable. But one, marketability nilisema it depends with your passion. Utasoma tu kwa sababu upate job, lakini ukipata job ukiachanishwa na mgonjwa hapo ama surgeon akimaliza mnaitanga operation but inaitangwa procedure. Akimaliza procedure, can you be able to handle that patient mpaka apone? Like, have you be able to sterilize those equipment? Can you be able to kupanga hizo set? Shaisikia mtu amefanyiwa procedure alafu kuna kitu imeachwa kwa tumbo. We have such cases. It happens because maybe theater technologist ni mtu alipita kwa vitabu tu ya kupita kwa hospitali. So it happens. So, for example, if it's a surgical set, you can have 34 instruments, for example. So, unafaa kucount, umepack 44, surgeon akimaliza umepack 44 tena. Kama ni 48, 43, inamaanisha kuna moja iko mahali. So you cannot release surgeon kabla hiyo ipatikane. So are you sensitive enough for that? It's a very good marketable, it's a very good course and a marketable one. And na uzuri is very practical actually. With a C- and above hiyo ni diploma. With a D plain and above hiyo ni certificate, and it is a progressive course. Course and a CINDAC, which is doing very well.
Tuko na Rugendo kutoka Embu anauliza, I have a C-. What medical course can I do?
C- akona more than around 60 diplomas zenye anaweza fanya na sisi.
Around
60 diplomas kama amefanya biology, kama anataka in medical line. Yes, unajua anafaa kuwa specific, like is it business, medical ama ni side ya technical. But C- iko na diploma. CINDAC, TVET, all the C- hiyo ni diploma. Na kama ni medical line bora amefanya biology.
We'll be giving your number in a very short while.
Let him
so that they'll
call,
be able to
so that I can send the list of the courses. We have so many of them.
Anasema alipata main grade ya C plane and a D plane in maths. Anasema can I take orthopedic as a course? Anaitwa Chip Kimboi.
Yes, he can. Orthopedic tunaangalia either biology, I mean amesema mathematics.
C plane.
So ama amefanya physics.
Na D plane.
Kama amefanya physics ama chemistry ama maths, one of them tunaangalia should be a D+ one of them. So kama akona D+ in one of them anaweza fanya orthopedic.
So maths ama
physics ama chemistry.
So maths of course imetoka kwa sababu maths ni D plane. Angalia the other two.
The other two if akona D+ one of them anaweza fanya. Ifana can mean grade kwa sawa, anaweza kuja bridge na uzuri orthopedic, anaweza bridge ukisomea the same course. Anaweza fanya ana bridge hiyo, for example mathematics, but ako class anasoma the same course.
That's the beauty
about it.
That would work. Sawa Paul, make sure you call and then mambo itakuwa iko sawa. Anasema good morning, at Goshen do you offer nurse caregiving course?
Yes, we do. We do.
So akuje apige simu.
Akuje hata tuko na intake sasa inaendelea, naweza mpea nafasi.
Alright. Now anasema anaweza fanya nursing, alipata B. I think kwa bio alafu C plane. No. Alipata B, that should be the main
grade.
The main grade alafu C plane kwa biology. Yes.
It's possible, but I need to know about languages na mathematics, chemistry, physics. I need to know. I wish anitumie results zake zote, maybe in my inbox. After here I'll be able to handle that, but from the main grade and biology already I'm qualified. So I need to see the other
subjects. So after this, please make sure that you call and then we'll be able to get back to you. Now, I know you have so many other questions, but we'll see if we'll be able to answer all that, because as I had said before, today we'll also be talking about cervical cancer, because this month is Cervical Cancer Awareness Month. All right? And today we have something that's happening at PGH Nakuru. So it's very important for us to talk about that as well. Kwa hivyo, we'll be talking about that. But naona watu wanauliza sasa, Goshen iko wapi? You've told us about Goshen, you've told us about Goshen. Iko wapi exactly?
Goshen iko Kiambu County. Specific Thika Makongeni.
Yeah.
Thika is a very famous city, it's an industrial city. We are turning it to be a smart city.
Yeah.
We are there, Thika Makongeni, behind a company called Leather Industries. Leather Industries imekuwa pale for the longest time.
Yeah.
Since I was born nilikuwa naiona tu hapa. So we are just
really?
behind Leather Industries. Wale wanajua MKU Pavilion, we are tumepakana tu na MKU Pavilion. Thika Garrison, because hiyo inaweza kuwa inajulikana sana, we are just opposite Thika Garrison. Ukiwa Thika Makongeni, ukiuliza tu Goshen utaonyeshwa. Vibao zetu ziko kila mahali. It's very visible. Yeah.
Okay. There's a question mtu alikuwa naye some time back, and this person was asking if they've been out of school for 2-3 years. Walimaliza form 4, but then they didn't join. So they were out of school for around 2-3 years. Is it possible for them to now come and take whatever course they want to do?
Even kama amekaa nje for 8 years, you can come.
Oh, really?
You can come na usome.
Okay.
Masomo, we have people who have done degrees, and hata kuna mwingine amefanya 2 degrees na amekuja kufanya another course there, and diploma course because of where she is. Because anahitaji pro. Na huyo mtu alimaliza shule mapema. Yes, so we have even teachers wenye wako tu hapa na wanasomea tu hapa na walimaliza shule mapema. So kusoma inanga miaka.
Yeah.
Kusoma inanga miaka. You can study anytime at any given age. So huyo akuje.
All right.
Na akuje hata kesho nafasi iko.
Sawa sawa, hata kesho nafasi. And it's even better ukienda wewe mwenyewe pale.
Ayajilete.
Yes, so usipige tu. If you're able to go there, the better. Anasema, hello, I have a C+ and biology, a C- and a C+ in English. What can you advise? So you're gonna C+, the main grade, then biology a C- and a C+ in English. What can you advise?
One, anaweza fanya health records and IT. Anaweza fanya orthopedic and trauma diploma.
Okay.
Anaweza fanya clinical counseling and psychology. Na pia anaweza fanya perioperative theater technology. Medical engineering anaweza fanya. Na pia laboratory science technology anaweza fanya.
Okay.
Yes.
That's a lot of courses. That's a lot of courses and pale, so that you'd be able to know what exactly you want to do. Anasema, hello, I am Meshak. I got a mean grade of B-. Nikapata C- kwa maths, biology B+, na chemistry C+. Can I do a medical course? English akona C+.
Yes, you can. Mean grade ni umesema B.
Yeah, B-.
Akona a very good course. Yes.
Okay.
Akona a very good. Hizo tu nimemention, you can still do them. Even umesema biology akona?
B- mean grade, akapata C- kwa maths, biology B+. That's really good. Chemistry C+, na English C+.
You can even do clinical medicine and surgery. If I can see mathematics, chemistry and physics, you can do.
Okay.
You can do clinical medicine.
All right. There's a person hapa alikuwa ameuliza the difference between being a doctor and a clinician. Are they different?
Yes, they are different. They are different in roles.
Okay.
They are different in roles. You need to realize that a doctor ana specialize. Clinician is general.
Okay.
A doctor ana specialize, like for example, kuna mtu amesomea mambo na udaktari lakini ni gynecologist. Kuna mtu yeye ni neurosurgeon. Kuna mtu wako it's like it's very wide. Huyo ni mtu specialize, but clinician ni mtu general in hospital.
A general doctor.
A general doctor.
Okay.
Yes,
Works well. Anasema, hello, salimia Mr. Peter. Goshen Medical and Technical College is a good school. Please, if you're looking for a school to join, Goshen is the best college. Anaitwa Brian Mwaniki. Brian, asante sana. Lazima ni mtu amesomea
Brian Mwiki. Yeah, Brian Mwiki is the former CU chairperson.
Oh, really?
Yes.
Sawa sawa, Brian. Thank
Modern
you.
Hospital now.
Oh, okay.
Yes.
All right. And do you help? I see you have very many questions, but I am very sure now we will have to make calls after this show because you might not be able to go through all of them. Yes. Now, do you help students get jobs after they're done, after the graduation?
We have so many of them, and I wish they can confirm. Like just the other day, we have done with the assessments in several parts of these nations. And we realize out of every 10 students we take in a certain hospital, 5 of them they are retained. 5 of them they are retained.
Okay.
We have around 25 of them when you wamemaliza attachments and they have been retained. Na walikuwa wanafanya certificate. So wameingia distance learning kuendelea na diploma wakiwa kwa kazi. So that one tells you what? We usually find attachment for our students.
Okay.
Tunawapeleka in those specific hospitals. And once tunawapeleka, tunawambianga kujitafutia kazi ni ni wewe. Because you are there, ni wewe utajitengenezea jina, ni wewe utajua venye utaperform. Kujitengenezea jina ni how you perform, how you relate with the people and such.
Okay.
So by the end of it, tukiwafanya assessment, unasikianga HR anasema ama nurse in charge, huyu mtu achie, huyu mtu achie, huyu mtu achie, awa they can go and continue.
Okay.
You see, so kazi tunawasaidianga. But sasa ukiwekwa kwa hospitali, find your space there.
Sasa hiyo it's up to you.
It's up
You've
to
done
you.
your part.
We have done our part.
Okay. And Eliza was also asking for the cluster points za kufanya neurosurgeon.
Neurosurgeon, that one you can do from degree level. Haikuangi na diploma.
Okay.
So that one is B+ and above. Sciences is a compulsory.
Zote.
Sciences zote ni compulsory.
Okay.
B+ and above.
Okay.
Yes.
Okay.
But that one is in degree level. Yeah.
Okay. Anasema, good morning Rachel and Mr. Mulandi. I have been an MBCI listener sincerely through that my daughter has joined Goshen and through admiring the CS. Okay, through Mr. Mulandi, she is doing lab. Is it lab technology?
Lab technology.
Okay.
Oh, wonderful.
Anasema, thank you so much. This is amazing. Asante sana.
Karibu.
And I know that she will do well. That one, very sure.
Definitely she will.
She must do well.
She will.
Yeah, so maybe the last question from here, the others will tutaziweka. We
I will
do
handle
that
them later.
Yes. Anasema, I got a B- in biology, Maths C, Chemistry D-, English B, Kiswahili A, okay. And then the mean grade was B. Can I do nursing? Anaitwa Pendo from Malindi. Aki mambo ya nursing. Oh
Pendo, that one is very possible. Anaweza fanya.
Okay.
Anaweza fanya nursing.
Which year? Is it possible for her to join right now?
Right now, no. Maybe next year. Next year we can try.
Okay.
Because there is a class we have preserved for those who are doing bridging, and you know you don't know the outcome.
Yeah.
But let her or let him, Pendo, let her reach us.
Okay.
We shall see how to help her if she is really in need of that.
Okay.
We'll see how we can help her.
Okay.
On the same.
Perfect. Nako Malindi, but you can always call.
Yes.
Najua ya kwamba
Malindi tuko na
utasaidika.
wengi sana wametoka huko.
Oh. All
We
right.
have even some in Malindi level 5. Wengi sana.
All right. Now, for the other questions, I'm sure we'll be able to get to you, but thank you so much for asking that.
Yes.
I am praying and hoping ya kwamba umesaidika for the questions that we've just gotten, but just to let you know that our numbers are still very open. We can always get back to you. But for you to get helped vizuri with the Goshen, I'm sure you'd be able to reach them. Now, for the people ambao wanataka ku reach, which are your numbers?
Now, if you want to reach us, you can call, you can text, you can WhatsApp this number 0750 264 044. That is 0750 26 4044. If you call that number, if you can text that number, kuna hao nimeona wanauliza about anaweza tuma results kwa WhatsApp kwa hiyo number. You'll be able to see the results, then atapata admission. And good thing is our admission is free. We don't charge for any admissions, and because we have scammers outside there, if anyone will call you akwambia ametoka Goshen na umtumie pesa ndio upate barua, that's a total scam. Then make sure you report them to us. Our admissions is totally free. Kama pesa utakuja kulipa immediately umeingia shule and you are very satisfied this is the right place for you, that's when you can make payments. We don't ask any payment, and the payments inakuanga the last bit after umefanyiwa everything else. So hapa katikati hatuitishangi wazazi pesa ama anything else in that line. And also we having admissions that is happening right now tumeanzia last week na inaisha by the end of this month. So this week, next week we are still having an intake, na pia kama utachelewa early February you can still join. But ukikosa chance this intake March tuko na intake the first week of March, that is March 3rd. From March 3rd tuko na intake, barua tushatumia wanafunzi, they are waiting to join. Akikosa ya March May bado tuko na intake first week of May. Akikosa ya May, September tuko na intake. So you don't have a reason kukaa pale nyumbani. And also a good thing is our marketers wako kwa ground. We are targeted to visit every secondary school in Kenya by the end of May. So if utatuona huko shule ujue barua yako iko shule, ama if haujafika shule you can still call us, tutakutumia barua kwa WhatsApp. Na wenda uprint mahali. It is very simple. By the way, we are very simple. The way you saw it. We are not complicated.
And it's a very serene environment to be. So pia kama mzazi you don't have a reason to worry.
Exactly.
Now let's talk kidogo about the accommodations, because I know that's something parents ask. So wakishapiga mtu ametoka Malindi, ametoka huko kote, do you have accommodations for students?
Wonderful. About accommodation, they should not worry. We have accommodation for both boys and the girls, and of course in separate places, which is very affordable. Wanafunzi wanapikiwa pale, kuna security, they have the matron, wako na professional chef, like they are taken well of. So mtu anatoka Malindi, mtu anatoka sijui wapi, because unatoa wanafunzi hadi Turkana, wengine wanatoka West Pokot. They should not worry. They just come, wakifika shule wataonyeshwa hostels. We have rooms for every student.
So kama uko pale, please, it's very important for you to know that Goshen is home away from home.
Exactly.
Utafeel vizuri pale, serene environment, you have enough time to study, you have a good place to stay. So that's the place to be. So kama umemaliza form 4, probably even you've already done something else, but you want to do a different course, Goshen is the place for you. So make sure you visit them. Please, you can just repeat your number. So that they can always call.
0750 264 044. 0750 264 044. Ama waingie tu kwa website as it is shown in your screen, www.goshencollege.ac.ke. They can still do application from there. They can download our brochure from that place. Waweze kuona all the courses that we are having. But they feel free to call anytime of the day. Hata kama ni saa 5 ya usiku, wa admission team wanakuanga alert. And good thing with us, we are open 24/7 by the way. Ukikuja shule hata Sunday utatupata. Because you saw we have a church there, so students come there for a church, then the office is open for any inquiry, for anything. Hata admissions tunafanyanga even on Sunday. So mtu asiulize na ikifika ni Friday kweli mnatokanga saa 9, because kuna hizo tendency. So tuko pale hata kama ni saa 1 ya usiku, you will find someone. Hautakuja Goshen ukose kuwa attended in any given time. Any given time.
Perfect. So that is it. Asante sana. Salimia watu wa Goshen.
Nimeshukuru sana. Na mko karibu sana huko Afya Clinic.
Thank you. Tutakuja.
Mkuje huko tufanye mambo huko.
We will be there. Perfect. So that has been it. Asante sana for tuning in for this particular segment where we've been talking about you as a person taking a medical course, taking any course that you'd want to. We've said that Goshen is a place to be. All right. Now we'll be taking a very short break because it's already 9 a.m. But as we come back, we'll be coming back to talk about cervical cancer. We said that this month has been the Cervical Cancer Awareness Month, and it's very important for all of us to know about it. We say that health is very important. Ukiwa na everything else but you're not able to stay healthy, then that becomes a problem. So we'll be taking a very short break. Tukirudi tutakuwa tunarudi na Pauline Kinywa, who is the senior oncology nurse at PGH. So usiende mbali. We'll be coming right back. If you have any question regarding that, tutakuwa tunaweza kukujibu as we tell you also what's happening at PGH Nakuru today, but also even more about the changes that are coming, because we said it's very important for you to stay healthy. It's very important for you to stay educated. All right? So we'll be taking a very short break. Alafu tutarudi usiende mbali. MBCI TV ambapo tunabadilisha maisha by the grace of God, and of course this is Afya Clinic. Tutakuwa hapa mpaka pale 10 in the AM, and today you are hanging out with me Kahogo, and as you come back we'll be having an amazing discussion. Thank you so much for tuning in for Goshen. Usiende mbali.
MBCI Television, transforming lives.
Unleash your creativity and style at Goshen Medical and Technical College School of Cosmetology and Fashion Design. Our school offers a wide range of programs that cater to your unique talents and interests, whether it's hairdressing and beauty therapy, nail technology, trainer of trainers, garment making technology, interior design, soft furnishing, or basic tailoring. We've got a program that suits your creative ambitions. Our programs are accredited by renowned examination bodies like NEC and NITA. We offer certificate, diploma, and a variety of other qualifications. A minimum of grade C or higher is required for diploma courses, D plain or higher for certificate courses, and D and below for artisan courses. For more information, visit our campus or call us at 0750 264 044 or 0723 047 468. You can also check out our website at www.goshencollege.ac.ke.
Welcome to Goshen Medical and Technical College Speaker. Yay!
MBCI Television, transforming lives.
We are back after that very short break. I had promised it to be very short. Sasa mumeona, it's very short. And we are back because it's very important for us to have this discussion. And yeah, we're very glad to be here. Najua tutakuwa tunapata the amazing segment ya healthy living once again. But just before we do that, let me just inform you on what we'll be talking about today. We've just had that amazing discussion with Mr. Mulandi from Goshen. And now we're back so that we can talk about Cervical Cancer Awareness Month, which is January, ambayo tuko already. And today we have something that's happening at PGH. So if you have any question you'd want to ask about cervical cancer, please, this is the time to ask. And we said, the other time we were talking about cervical cancer, tulisema that sometimes kuna a lot of stigma that surrounds that, and Najua Doc will be telling us about it. But just to let you know that today we are having Pauline, and she is the senior oncology nurse at PGH. What wengi wanaitanga PGH, it's level 5, but we'll be talking about that more. But karibu sana for this discussion. Thank you so much for staying, for tuning in. We do value your time. This is MBCI TV, where we transform lives by the grace of God. And of course, today you're tuned in for Afya Clinic. Tutakuwa hapa mpaka pale 10 in the AM, and our numbers are very open. That is 0721 105 105 23814, our SMS code, which is absolutely free. But of course, you're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. Now, let's get the healthy living so that you'll be able to get that segment by Sylvia Wanja to help all of us live healthy. We said that it's very important for us to stay healthy. Sawa. I will say again that as much as we pray to God for us to get everything else, that includes having a very good family, having money, which is very important. Tukikuwa na hizo zote and you're not healthy, it might not be very possible for us to enjoy all that. Sawa. So that's why we talk about staying healthy. Now let's get the healthy living, and then we'll be coming back for this amazing conversation. Usiende mbali.
Hello and welcome to Healthy Living. My name is Sylvia Wanja. Healthy living is about adopting habits that promote physical, mental, and emotional well-being. Here Hello and welcome to Healthy Living. My name is Sylvia Wanja. Healthy living is about adopting habits that promote physical, mental, and emotional well being. Here are practical tips to help you lead a healthier and more balanced life. Number 1, maintain a balanced diet. Eat a variety of foods, include fruits, vegetables, whole grains, lean proteins, and healthy fats in your meals. Limit processed foods. Avoid foods high in sugar, salt, and unhealthy fats. Stay hydrated. Drink plenty of water throughout the day to support digestion, energy, and overall health. Practice portion control. Avoid overeating by eating smaller portions and listening to your hunger cues. Number 2, stay physically active. Engage in at least 30 minutes of exercises on most of the days of the week. Activities could include walking, jogging, cycling, and swimming. Incorporate strength training and flexibility exercises to enhance muscle health and mobility. Take short breaks to stretch if you sit for long periods. Number 3, get enough sleep. Aim for 7 to 9 hours of quality sleep each night. Create a consistent bedtime routine and sleep schedule. Avoid screens, caffeine, and heavy meals close to bedtime. Number 4, manage stress. Practice relaxation techniques like meditation, deep breathing, or mindfulness. Make time for hobbies and activities you enjoy. Seek support from friends, family, or professionals when needed. Number 5, practice good hygiene. Wash your hands frequently with soap and water to prevent infections. Maintain oral hygiene by brushing and flossing daily. Keep your living and work environments clean and organized.
All right, so that is it about healthy living, and it's an amazing segment right there by Sylvia Wanja. Asante sana. Now, we're back to talk about cervical cancer, and as I had told you before, we'll be having Pauline Kinywa, who is the senior oncology nurse at PGH. Karibu sana.
Asante sana.
How are you?
I'm good.
We're really glad to have you here today.
I'm also glad to be here.
Yeah.
At least we get to educate each other, and most of the community where the people are. That is the most important part of it all.
Amazing.
Yes.
Asante sana. PGH kukoaje?
Kazi tu.
Yeah.
Tunang'ang'ana polepole.
Amazing.
Yes.
And I know there's something that's happening today. We'll be talking about that in a very short while.
Yes.
But before tuendele sana, please say hi to the people and then you can go on. This is your camera.
Good morning, everyone. My name is Pauline Kinywa. I'm glad to be here at MBCI TV.
Yeah.
We get to educate each other and know more about cervical cancer. This being the Cervical Cancer Awareness Month, we need to eradicate this disease. It's one of the diseases that we can be able to eradicate because it's one of the most preventable cancers that we have. And if we take note of everything that is usually advised, the guidelines and everything, we will get 20, 30 years from now, the numbers will have dropped. Yeah, because considering cancer is the second most common cancers in the whole world, not only in Kenya, not only in Nakuru, but in the whole world, but also is the most preventable cancer that we have. So let's get to know about cervical cancer, how you can get tested if you are sick, how you can get treated, and the support, other support system that are there. For the cancer patients, for the cancer survivors, for their caregivers, for the community and everybody around. Yes.
You know, every time I hear doctors talking about how cervical cancer is the most preventable, yet the highest, that like most people die from cervical cancer among the cancers that are there, it really saddens me and confuses me kidogo, because it's the contradiction that it's the most curable but most preventable, but pia ndio most of the people wako nayo, and it's very important for us to talk about it so that we'd get people to understand. Then if it's preventable, how can people prevent themselves from getting it? But before we even get to the prevention of it, in layman's language, cervical cancer ni nini?
Cervical cancer, if I can say, ni cancer ya njia ya uzazi. Because in the reproductive system, the cervix is one of the organs that connects the uterus and the vagina. So that is where the opening happens and the baby gets out of the woman's womb. So it's called the cervical cancer because it is the cervix organ that is usually affected.
Okay.
Yes.
Okay. And what are the risk factors for cervical cancer?
So risk factors of cervical cancer is starting sexual intercourse at a very young age, because you get, in the course of line, you are going to have multiple sexual partners. So the second one is usually multiple sexual partners. The other one, we have, if you have risk of STIs, chlamydia, syphilis that has not been well handled, because most of them you get, we have so many types of the HPV that can, that usually causes other STIs. Yeah. So if it goes untreated, it can change how the cells of the cervix around the cervical area looks like, and with that, with time, with that exposure, you will get cervical cancer. We also have family history. If you have first-degree family history of somebody who had cervical cancer, maybe your mother, the sister to your mother, possibility also of having cervical cancer is very high. Use of things like tobacco can also predispose you to getting cervical cancer. Women who are HIV positive because of the immunosuppression, they are also highly susceptible of getting the cervical cancer.
Okay.
Yes.
Okay.
Yes.
Let's talk a bit about the family history.
Yes.
How does that happen?
So in the family history, when we are dealing with cervical cancer, we've always said when you check the cells under the microscope, you'll be able to tell, we have different types of cells that are around that area. We have the squamous cells and we have the adenotype of cells. So most of the time for the family history, you usually get that they get the cervical cancer that is adenotype. Okay. Yeah, but the one that is usually sexually transmitted is usually the squamous cell carcinoma of the cervix. Okay. Yes. Okay. Sorry for going deep into, yes, because now when you start talking about family history, now people have to get where the difference between the two comes in. Okay. Yes.
And is the treatment of the two different?
No, the treatment is the same.
Okay.
Yes.
And can it be prevented, the family history one?
Family history, I've always said, those are cells that runs into your family. So those ones, most of the time, with screening and early diagnosis, at least we can be able to improve your quality of life and eradicate the disease 15, 20 years later, you can be disease-free.
Okay.
Yes.
Okay, works well. Now, what are the very early symptoms that can be used to catch cervical cancer?
So cervical cancer, I've always said, because the cervix is the one that is affected, so most of the symptoms that we usually, the early symptoms, they will come from symptoms of your lower genitourinary. You'll have abnormal discharge, you'll have abnormal bleeding, you can have bleeding after intercourse, you can have recurrent UTIs, infections that are treated and you're not getting any improvement. You can have the low abdominal pain. So with time, as the disease is advancing, that's where you get people have nausea and vomiting, you are losing weight, you are having pain, but now that one is usually in the later stages. But in the early stages, it's just anything abnormal down there, abnormal discharge, bleeding. Yes.
Okay, okay.
Yeah.
Now, after you've realized that you have some of the symptoms that you've said, what is usually the very first step that someone should take?
So the first step is you visit a health facility that is near you. We usually take a detailed history of how the symptoms started. Now from there, that is where it's going to guide us. Ideally nowadays, in most health facilities, what they do, if they take a detailed history, they do a physical examination and they see that you are at risk, you are going now to be subjected, that is with your consent, you're going to be subjected to screening. We have different modalities of screening depending with your age. We have the Via-Vili, we have the pap smear, we have the HPV. So once that one has been taken, if it's Via, that one is something that you'll visualize. Within 5 minutes, you'll have the results. Now that one is going to guide you. If it's pap smear, you have to take at least 5 to 7 working days for the cells that are going to be collected to be analyzed. Also for the pap smear, the same.
Okay.
Yes.
Okay. You've mentioned about HPV.
Yes.
I know we'll talk about the pap smear kidogo because that's a term that people have heard about, but HPV as well. Now, what is HPV?
So HPV is an acronym of the human papilloma virus that has been found that causes cervical cancer. So we have so many types of HPV, but the ones that have shown the highly susceptibility of causing cervical cancer is HPV-6 and HPV-8. Those ones are the ones which usually causes the cervical cancer. So during the HPV screening, what we do, when we collect the cells and we analyze them, if it's going to be positive, these two are going to be present in your cells that are going now to make you have the cervical cancer.
Okay.
Yes.
Okay. Now, how's one supposed to go about the HPV?
So this one, I think now we are just going to jump the hurdle.
Yeah.
So HPV has been recommended as a screening modality for all ages.
Okay.
And previously, you used to go to the hospital for you to get the HPV screening to be done.
Okay.
But right now, with new modalities and everything, like even today in PGH, there is a new screening modality that we are going to launch through the Ministry of Health and National Cancer Institute.
Okay.
We have a new device for oncoprotein that is going to collect the cells around your cervical area that uses the HPV. That one you can be able to do it at the comfort of your house. So you're going to be taught how you're going to collect the cells, how you will transport now the specimen that you've collected to the hospital for it to be analyzed.
Okay.
The good thing with it is it's like the test that we are using. Nowadays, it's like the HIV one. Even you can be able, if you get the strip, you can be able to do it in the comfort of your house.
Okay.
Yes. Yes.
So that's way better also with, you know, well, we started, we talked about how kuna a lot of stigmatization around cervical cancer.
Yes.
So is that also coming along to help with that?
That one is going to help, but I've always said with the stigmatization, one thing we should remember is it means that the people are not informed outside there. That's why there's a lot of stigmatization.
Okay.
People are not sensitized. People do not understand that cervical cancer or any other cancer is just like any other disease. Yes, it's like malaria. It's just that that's a diagnosis. It's the same way you will go to a hospital, you'll be told you have hypertension, you have diabetes. But we don't stigmatize these people. But with cervical cancer, there's a lot of stigmatization because most people, even if you ask around the community, once a diagnosis of cancer has been made, they usually take it as a death sentence, which is not usually the case. We have people who have been treated and they are living very good life, 10, 15 years down the line.
Okay.
Yes.
Okay. What's the percentage maybe of the cervical cancer survivors?
We have a good number.
Okay.
We have a good number because most of the patients that we usually treat, you know now, the most unfortunate thing about cervical cancer and maybe all the cancers that are there, because of that stigmatization, we usually get people in very late stages. But we try our best to give you the best to improve your quality of life and your overall survival. But nowadays, with sensitization, people are coming up. We are able to capture cancer even when they are precancerous lesions. They've not yet blown to be cancer, but we've been able to capture them just before they start transforming to be cancer. And that one you get, once the diagnosis is done, it is cheaper. The side effects are lesser as compared to once you start treatment when the disease has already grown.
Okay.
Yes.
Okay. So it's very important for people to come for screening.
Yes.
Even without the symptoms.
Yes.
Wakuje tu.
Sasa screening, now that's the whole idea of screening.
Yeah.
Screening, you don't wait for symptoms. Screening, you just look at the affected population. This is the affected population. You encourage those people to come to the hospital with no signs, with no symptoms. You start looking at them for the disease early. So with that you will be able to capture the disease early before even the symptoms start to show. Okay. Yes.
Okay. Rather, how many times is a lady or any woman advised to come for screening?
So that one is dependent of your age. Ideally, we encourage women from the age of 25 to start screening. The reason as to why we usually say up to the age of 25 is if you're sexually active, you are already predisposed to the HPV virus. But the good thing with our body is we are usually able to fight those viruses with your immunity. So that's why if your immunity is okay, you usually get that, you'll be able to fight off the disease. But now at the age of 25 is if you are predisposed at a very early age, you are going to have the changes of the cells are going to be there. So that's why we usually encourage from the age of 25. And then now from there, depending with your age and the risk factors are things like HIV, multiparity, if you have a multiple sexual partner, or if your partner has multiple sexual partners, it's not usually a one way. So that one you'll get, if you are high risk, we are going to tell you after every 3 years we want to be doing screening for you. If you're not a woman of high risk, we'll be telling you now we are going to be doing that after every 5 years. So it's not usually a one-time thing. So from there it's supposed to be subsequent depending with your exposure.
Okay, perfect. Now, as you were starting, we talked about January being a cervical cancer awareness month. As you said that it's one of the most preventable, and you've told us why, because once you get the screening early enough, then it's very possible for you to get it at a very early stage. But maybe why is it that the WHO decided that January should be specifically cervical cancer awareness month?
So one is with the numbers, the numbers that we have so many women with cancer. So for us is usually now these numbers have already grown. What are we supposed to do about it? And you have to initiate whatever decisions that are going to help. So when the WHO realized that cervical cancer is going to be, we have a high burden of cervical cancer, what are we going to do? So they decided, no, next month, let's start making the community aware that there's cervical cancer and this is what they are going to do. Yes, and that's how the January month came in.
There's something that's happening at the PGH today. Tell us about it.
So today at the Nakuru Level 5 Hospital, we are having free screening of cervical cancer. We are not leaving anyone behind, so we are also going to have a screening for breast cancer and prostate cancer. And then also today through the Ministry of Health and the National Cancer Institute, there is also a new kit of HPV that is going to be launched. And it's going to be launched at the Nakuru Level 5 Hospital, where we have the new test that I was telling you about, that you can be able to do it at the comfort of your house. If even the strips are not available, if you take the cells in the hospital, within 20 minutes maximum, you'll have your results.
So this is a call for everyone to come and know the status, get screened. And you said it's not only for cervical cancer today, it's also for?
We are also having for prostate. You know, we can't leave men behind. And since men don't have cervix, so for them, because prostate is one also of the common, it's the most common cancer in men. So we are not leaving the men behind. We are going to have screening for prostate cancer and also for breast cancer. Remember, breast cancer is also the highest leading in all the cancers. So we can't also leave it behind.
Why is it that breast is the leading breast cancer?
You know, now the tricky part is the cause of cancer. All the books, if you read, the first statement is usually the cause is unknown, but it is related to. So we all have breast tissues in our body. And then right now with research, it has shown that in women, especially the African, Black African women, we are more at risk of getting breast cancer, especially the most aggressive ones. I don't know why. That's what research has shown. So we don't usually leave behind. Because now the good thing also with these cancers, they are screenable. So anything screenable that you can be able to prevent, that you can be able to detect it early, is always good to include it in the screening process.
But you've also said that there's hope, it's treatable, there are cancer survivors. And it's a good number, as you said. Because you know, most of the people who say, kama already si feel na sijui niko na cancer, why should I go niende nijue nianze kuishi na pressure?
Kweli kabisa.
Yeah, so they prefer, let me just live like that. Ikiwa mbaya, I'll know. Yeah, but as you've said, it's very important for them to go get screened. If it's ikipatikana early enough, then it's able to get treated.
Yes, and then the good thing is in Nakuru right now, all the cancer treatment, you can be able to get it here. You don't need to travel anywhere to get the treatment.
Yeah.
We can be able to do the diagnosis here. We do the staging here. We do the treatment here, and the supportive care post-treatment, you can be able to get it here.
Yeah.
Because one of the treatments that we usually use for cervical cancer, it's either by use of chemotherapy, which is available at Nakuru Level 5 Hospital, covered by SHA.
Okay.
You can also get a radiotherapy here, which is there, and also brachytherapy, which is here. So you do not need to travel everywhere.
Yeah, also covered by SHA?
Yes, all of them covered by SHA. Yes.
Okay. Now, there's someone who's asking here a very intriguing question. Anasema, what are the causes of blood in urine? I think Anauliza, would it maybe be a sign of cervical cancer?
Remember what I said is one of the symptoms is abnormal bleeding. And for women, remember when you are going to collect the sample of the urine, because the vagina is also there and it's open. Now when you're collecting, there is going to be the droplets of the urine. So after analysis is when we usually tell you now what is usually the cause of the bleeding. Because it could be the irritation of your vaginal wall. It could be bleeding from the cervix. It could be you on your monthly period. So once you go collect the specimen of your blood, there's going to be blood in that. And also the bladder can also be irritated. So when you're urinating, there could be blood. So we don't usually treat one symptom. That's why I've said, once you come to the hospital, we are going to take your history. We are going to do the physical examination. And then now from there is when we are going to subject you to investigation. And then now from the investigation is when we will get to know more about what's happening in your body.
Okay. Anasema, good morning, doc. Anasema, I've been having abdominal pains. What could be the reason?
The abdomen is usually very big, very large. So we have, it could be on your flanks, it could be on your lower abdomen, it could be on your upper abdomen. And I've always said, let's not treat the symptoms. Visit the nearest facility. Let them go, let them do thorough examination, and then from there they are going to send you for investigation. Now through that is when we are going to get the right diagnosis. Yes.
Okay. Kwa hivyo, you said something very important. Do not treat the symptom. Because kama wa Kenya, we love treating ourselves. Inakwanga just 2-3 symptoms. This is the reason, and the next thing you're already treating yourself. So it's very important for us not to treat ourselves. Please, Kenyans, thanks. Now, I know we are talking about cervical cancer today, but I had a question about breast cancer, which I think it's very important because today you also be doing the screening for breast cancer. Which are the symptoms that one can easily catch for breast cancer?
So for breast cancer, what it starts like a lump in your breast, but not necessarily your breast. At times you will get breast cancer, the lump is appearing in your armpit. There's nothing in your breast, but we have something in the armpit. So we can have lump either on your breast or your armpit. We can have abnormal discharge, not unless some mother who's breastfeeding or women of reproductive age. At times when you press your nipple, you'll get that there's water that is coming out. If you're breastfeeding, there's going to be milk. But you get some people when they press the nipple, you're going to have either blood or pus coming out through your breast. And then also the skin around that area can turn, it looks like the orange peel skin. That one is because the tumor is growing and it's now compressing the skin area. We can also have retraction of the nipple. You get the nipple now, it's inverting inwards. And then with time now you'll get, now that's when we are having the pain because now the tumor has already grown. That loss of weight. But those ones now are later symptoms.
All right. Wow. So please go get screened. It's very important. Now let's get the mythbusters. We have some of the myths that surround cervical cancer. Now we'll be getting to look at them, and then you'll be telling us if it's a myth ama ni ukweli. Yeah. All right. Now let's get into the mythbusters. And the first one says that only women with multiple sex partners get cervical cancer. Is that true or false?
That one I'll say that the only word that is making the whole statement to be false is only women. Yes.
Okay.
Yes, because remember we said we have other predisposing factors like HIV, multiple sexual partners. So multiple sexual partner is one of the predisposing factors, but it's not only women who have multiple sexual partners. That one is it increases your chances. Yeah, because remember the other risk factors we talked about, like the family history, tobacco use. Yes.
Yeah. Okay. The second one is that older women don't need cervical cancer screening.
So, I don't know. What do you mean by older women? What age?
Yeah, what's the age of older women, by the way? But maybe we can talk about who needs cervical cancer screening.
We usually recommend all women of reproductive age from the age of 25. But from the age of 65, there's no need of that one continuous screening, not unless a woman has shown signs of cervical cancer that requires us to screen. Okay. But the recommended age is usually from the age of 25 up to the age of 55, because now that's where they usually most sexually active. And then now from the age of 55, that's where we are going to be giving you the period when you'll be doing your screening after every 5 years. And then after that, from the age of 65, now that one is subject to that one. It's individualized now from there. Yes.
Okay. I see. And the last one, which is that men don't need to worry about HPV.
They need to worry. Remember, men are the cause of all our problems. Yeah, because remember, the men are the carriers. Yeah. One of the risk factors we said it's having multiple sexual partner or your partner having multiple sexual partners. Yeah. So they need to worry. Okay. And you get in developed countries like the US, the UK, the HPV vaccine is usually even given to the boys. Yes.
Okay.
Yes.
Okay.
Yeah.
But now my question is, men don't really get affected by HPV, really. But why is it that they're the carriers, ladies are not the carriers, but them they get affected? Is there...
Remember, the carrier is going to bring the disease to you. And then now for us, because we have the organ, we have the cells that are affected. Once the virus is deposited in your cervix, now it is going to now cause the changes of the cells around that area. Okay. So for them, they are carriers. That's why I've said they are the cause of most of our problems. Yeah. Yes.
Okay. Anasema, good morning, doc. Please help. When I go for a short call, it's very burning. Okay, and I say even after going for a short call, bado wanasikia it's burning. What could be the problem? Sema there's a burning sensation every time they go for a short call.
So burning sensation could be it's a symptom. That's why I'm telling you there's nothing as bad as treating a symptom. So I've always said visit the nearest facility, let them do thorough investigation on you, because it could be a urinary tract infection, it could be a sexually transmitted infection, it could be a sign of something else, because you usually get even people who have kidney stones. When they are urinating, there's usually that burning sensation. So you cannot treat the symptom exactly. You need to go do further investigation, know the cause of the burning sensation, and then now from there get the right diagnosis, treat the diagnosis well.
Okay.
Yes.
Okay. Nasema good morning. Mimi ni Wairimo kutoka Juja, Kenyatta Road. Nilifanyiwa screening in the year 2021. I was undergoing chemo and Lisa, is there any need for another screening? I'm 56 years old.
Screening, like I've said, we recommend it to all women. From 2024, I'd love to know what treatment was she getting. You know, it could be treatment for breasts, colon, cervical. Yes. So because if it's cervical, we have we have ways of how we usually do your follow-up from there. If it's any other organ that was being treated, remember you're still at risk of getting cervical cancer, so it's always good to get treated. Yes, so depending with the diagnosis that she had before. If it's cervical cancer, we have modalities of how we usually follow up those patients. If it's any other organ that was treated, remember you're still at risk of getting cervical cancer, so screening is usually also still recommended. Yes.
And this is a question that recurs very oftenly when people ask for the cancer survivors. Let's talk about cervical cancer survivors. Is it possible for the cancer to reoccur, or rather reappear?
Yes.
Okay.
Yes.
Why?
Remember those cells were affected, and I've always said with the cancer cells, they're usually sneaky. They are one of the sneaky cells that you can have in your body. You can get that we treated you, you got better, we declared you now you are disease free, and then maybe 5-10 years again from there, the disease recurs. Yes, because it could be there is a cell that went into slumber in your body. Yes, and it just slept for 5 years, and then from nowhere it decided now to re-energize again with your body. Yes.
So what should be the way forward for someone who's been declared cancer free?
No, for them, there's usually follow-up. We do 3 months follow-up for 1 year, and then every 6 months for another 1 year, and then from there it's going to be annual follow-up. Yes.
Okay. Works well. Works well. Now, I see we still have questions coming in, but for the people who need to get checked, maybe we'd be giving the directions to the PGH once again later. But what would be your word to the community or the people who are watching us about cervical cancer and any other type of cancer, really?
So what I'd love to tell the people outside there, cancer is preventable, especially cervical cancer, it's preventable. Let's educate each other in the community that yes, sex is a normal proceeding of the body, but let's practice safe sex. If we need to have sex, let's practice safe sex. Let's reduce the number of partners that we have.
In fact, just unless you're married with your husband or your wife, if not, let's even start with abstain, please. Thanks.
Yes. So another thing that we recommend is if you're HIV, if you're a woman who's HIV positive, ensure that you follow up your clinic very well. Because once you strengthen your immunity, even if the cells are there, remember your body will be trying to fight the disease. So it will be trying to suppress those viruses as much as possible. The other thing is get tested, do your screening periodically. If it's after every 3 years, if it's after every 5 years, ensure you do your screening. If you have girls who are young, between the age of 9 to 13 years, 14 years, take them for the HPV vaccination. Because now that one you'll be able to sensitize their body. The immunity is going to be strengthened such that even if the virus comes, the body will be able to fight it. Yes, and then another thing, let's stop the stigmatization outside there. Yes, let's support these people. Cancer is just a disease like any other disease. It's just that I don't know why we were given such a big name that everybody fears. But it's a disease like any other disease. Once the diagnosis has been done, get help from the right people, because now that's another problem that we're having. People are going for mitishamba, people are going, I don't know where to do what. So just get help from the professionals, and we are going to improve your life, kabisa.
Okay, perfect. It's good that you've said there's hope. So all is not gone. Once you've realized that you have cancer, after the screening, you'll get help. As long as you get help from the right people, you'll continue with your life as normal. So it's very important for us to reduce to stop rather the stigmatization around cancer. Okay? Now, once again, what will be happening today at Nakuru PGH? If you're around Nakuru or in Nakuru, please make your way to PGH today.
So today at the Nakuru Level 5 Hospital, we will be having free cervical, prostate and breast cancer that will be happening at Block 9. So once you get there, even at the gates, even if you ask the soldiers or anybody working around that area, they're going to show you Block 9. That's where the screening will be taking place. We will be also launching the new HPV testing kits today through the Ministry of Health and NCI. So come there. There's going to be so much. There'll be so much health education about cervical cancer, about prevention, about HPV, because we've also realized there's also a lot of stereotype and, around the HPV vaccine. So you're going to get the right information from the experts. Yes.
Okay. Perfect. Asante sana. I see we have questions coming in, but because of time, maybe we wouldn't be able to answer all that, but asante sana for coming. We do really appreciate. So for someone who needs to get treatment, please would you tell us where Nakuru Level 5 is located?
Nakuru Level 5 Hospital is along the Sigor Road, that is on the showground. It's adjacent to Moi Primary. So once you get there, everybody knows where PGH is. Ukiuliza tu Medi, watu wanajua Medi. Medi wanajua ni wapi. Everybody will be able to direct you. Yes.
Thank you so much for coming today, Doc. We do really appreciate. And I know it has been a good time even for the people to learn. Just learn so much about cancers, which is very important for all of us.
Thank you for having me.
Asante.
Okay.
Thank you so much for tuning in today. Thank you for your time. We've been here right from 7:35, and I know that we've been able to just gather as much information as we needed. All right. And of course, if you have any question about Goshen, we did give the numbers, so you can always call. And kama uko Nakuru or around Nakuru, please make sure you make your way to Nakuru Level 5, well known as Medi ama PGH, Upper Nakuru, and you'll be able to get the help that you need. If you're not in Nakuru, I know there are Level 5 hospitals in your county as well.
So what we are doing today, all the sub-county hospitals in the Nakuru County are doing screening. That is Naivasha, Rongai, Gilgil, Subukia, Bahati, PGH. Yes, all those sub-county hospitals are doing screening. So you don't need to come to Nakuru. Go to the health facility near you, the sub-county hospital, and you'll get screened. Yes.
Free.
Yes, for free.
Okay.
Yes.
Perfect. So mbona unakosa kwenda leo surely and it's free? Make sure you go there. Sawa sawa. So that is it. Asante sana once again.
Karibu.
Asante.
Yes.
Yeah, and thank you so much for tuning in. Tunawapenda sana. Thank you for making your time for this particular program, Afya Clinic, right here on MBCI TV. So that has been it. We've had Pauline, and we're very glad that we've been able to have this particular conversation. So for more, we'll be getting this conversation on Saturday. Sawa sawa. Saturday usiku. So don't miss out. All right, but for now, let's get the did you know, so that you'll be able to see. Of course, unajua ukiona did you know inamaanisha kwamba tunaenda kumaliza kipindi ya leo, which has been really amazing. And today's did you know imeandaliwa na the one and only Martin. So, did you know a single sneeze can travel up to 100 miles per hour? Did you know that? We say that, did you know ni ya kwenda pia wewe una research, unajua. And I'm thinking this is why we were told that it's very important for us to be wearing masks. Yeah? Because if this actually is it, then it means we need to be very, very, very careful. Especially kama kuna homa. Asema, did you know, maybe you can get it one more time. Did you know that a single sneeze can travel up to 100 miles per hour? Did you know that? Please go check it out. And research. It's very important. Now, that has been it on today's show. That is Afya Clinic on MBCI TV, where we transform lives by the grace of God. Once again, thank you so much for tuning in. We've had a good time. We have learned. We've had your questions. Tumejibu ambazo tungeweza kujibu, which are most of the questions ambazo zimeulizwa leo. But if we've not been able to answer your questions, you know where to send in your questions, and you'll be getting an answer to all of that. If you'd want us to have this conversation again, pia tuambie through our numbers. We said that we are here for you. So if you want us to have this conversation nao vizuri about the cancers, please tell us through our numbers, and then we'll be able to have that conversation, think around it, and have our guest right here once again. See, utarudi?
Nitarudi, mukinialika.
Tukikualika utarudi. Asante.
Mukinialika.
Mnaona amesema atarudi. So if you want us to have that conversation, please tell us. All right? Have an amazing rest of your day. Today is Wednesday. We'll be having lunch hour from 12:30 up to 2. Please remember, up to 2:30 actually. Please remember that we are already into the time of prayer and fasting. So this is the time to talk to God. Please, if you can be able to come to Kingdom Seekers here in Nakuru, it is the best way to come and just, you know, the word says that we are 2 or 3 are gathered. So ukikuwa hapa physically, the better. All right? So God bless you. Thank you so much for coming. Have an amazing rest of the day. My name is Kahugu, and as I said before, on all social media pages, you can tap as Rachel Kahugu. Any question that you have regarding Afya Clinic, we'll be able to answer. All right? God bless you. God be with you. Have an amazing rest of the day. Bye-bye.
Olodumare, my one and only, the giver of life, equal to